I'm excited to introduce our panelist, Amber Donaldson. She's the Senior Director of Sports Medicine for the U.S. Olympic and Paralympic Committee. And we're so excited she's here because she knows firsthand all of the ins and outs of what's going on with COVID and how it's affected things, especially competition. So if you are all ready to go, Amber, I will toss it over to you.
Great. Thank you so much. And thanks for having me. As we've all been living in COVID, and obviously, it's a part of our world now and probably will be for quite some time. So thinking through kind of the event planning, just trying to point out some of the things to make sure are on your kind of radar as you start to plan for events. So, and just a little bit more background about me. I'm a physical therapist, the director of sports medicine here, and the head liaison for Paralympics. I've been the medical director for the last few games on the Paralympic side. So work a lot with our para side of the house. So next slide. Most of us know and have heard and seen this information about COVID probably many times over the last several months. But it's very interesting. And as we're learning more and more about the virus, we're learning that it's not just a respiratory infection, that it's really a systemic infection. And, a lot of people have cardiac damage actually after COVID, which is why we're doing a lot of cardiac testing above and beyond kind of, even if somebody's asymptomatic, but we find that they've had COVID. So there's a lot of, and a lot more that we're probably going to continue to learn about this virus as time goes on and we get more kind of data and long-term data, and especially in an athletic population, how that differs potentially. So next slide. We also, yesterday was one of the worst days in the US with 100,000 new cases. So it's not going away, and it's actually spiking. Almost every state is in the red currently. And so understanding how each of your communities is handling that, where your numbers are, all of that's going to play into your decision-making process. So this, slide says post-COVID, but it's really a during COVID kind of discussion. And there are and have been some really successful events that have gone on during the middle of COVID, the US Open, NBA, and they've been able to create bubbles in different ways to make a successful competition. So it is possible. There's just a lot of extra planning and thought that needs to go into that. Next slide, thank you. So obviously looking at the financial impact, anytime you add extra steps, there's going to be a financial impact. And so what does that look like for additional staff, or if you can't have spectators and that's your revenue coming in, what does that look like? How do you cover the testing, the cleaning, all of those pieces? And then looking at the event date, the date needs to be a little more flexible potentially, or further out as you start to look at things as to how much time do you need for an athlete to kind of really adequately prepare, both physically if they haven't been training, but also to go through testing. Where are they coming from? Are they coming from a city or town that's, of a higher prevalence or lower, or internationally? And what does that look like? And then, the training facilities, do they have access to them? A lot with universities closing down and health clubs and things like that reclosing. It's becoming harder and harder to find places to train. And so are they going to be safe? It's good to have an event, but if they actually haven't trained, you may be setting them up for more injuries and things like that if they haven't had the proper preparation. So keeping those things in mind, and then really working closely with your public health authorities. Every state is different, and we've been working with that. Every county is different in some places as to what their cutoff is, what their guidelines are. New York is very different from all the other states that we work with, because they require the 14-day quarantine for any states that are above the 10 per 10,000, which is pretty much every state currently. And so things like that just become a little bit more challenging to know the guidelines, and they also have to have a negative test before entering the state, where others are a little bit less, strict about that. So understanding that and also having good communication with your teams. We've had reached out to the government multiple times just to ask for kind of leniencies in allowing us and not kind of clumping us in with health clubs because we are different. And so having that good communication and relationship with government officials in your area, it can be really beneficial, especially if you're trying to put on a program. And then is the venue going to be available? Obviously for kind of the same reasons that I mentioned with training facilities. Next slide. So as you come up with determining your event location, ideally you're going to want to pick some place that has the lowest transmission region. So right now Utah is very high, North Dakota, Colorado is skyrocketing. So, and obviously this is changing day by day, so it's hard to plan for something 6 months from now and know which state is going to be high or low. But just trying to think through that, some states are a little bit more cautious in just kind of their guidelines, and others are not. So keeping that in mind, and then what is the infrastructure you have for that event and your mitigation factors, which we'll kind of go through in a few moments. Is there enough space? And you need a lot more space, not only for the competition piece to keep athletes, at least 12 feet away if they're exercising, and space for treatments, that you can't have beds kind of right next to each other. Because if one athlete or individual gets sick and you've contact traced everyone that's within this space, you've kind of wiped out a whole group. So much as you can keep people apart, keep them in separate cohorts, so that not the entire group or training group is together, and that there's some definition and difference between the locations and the number of athletes or individuals that are in one space at a time. It becomes a lot more logistically challenging to do so, but ultimately it's better if you do get someone that gets sick, you can still maintain the competition. And so then looking at if you're going to do a series, ideally you would carry that out in the same location so that all of your mitigation plans can be consistent. Everyone kind of knows the process already, and I know that's difficult sometimes, and there's benefits obviously to having things in different cities, but then you've kind of got to start over, and all the different nuances and challenges that a city brings to you makes it even more challenging. So for simplicity and also for kind of less risk, it is better to consider having things like a series in the same area or same venue. Next slide, please. So looking at those with risk, obviously the higher risk sports are those that are contact sports, where you can't really keep a distance. And then and you can have, barriers, and athletes aren't necessarily wearing masks, but, if there's things flying like spit and sweat and things like that, and you're within that range, there's just more risk. Where we've got some of the moderate risk, where there's still some contact possibly, but not as much as kind of a constant contact like a taekwondo or rugby. Where low risk sports, I have those listed there, are, tend to be more individual sports, though like a powerlifting, you may have, individual spotting or assisting with things within a close range, helping with equipment and things like that. But it's, you can kind of assist and then back away, and there's not a straight on kind of 5-minute direct contact necessarily. So just keeping those in mind, it's a little bit easier to wherever you can maintain physical distance is ideal. So even in those contact sports, and we have some of our contact sports are going and training like wrestling, and we just keep we keep the same cohort together, and we don't mix those groups, so that it's just a little bit cleaner for tracking and making sure that they know who they're in contact with all of the time. Next slide. So with the planning, making sure that you really have a good medical team, and this is probably more important than even before, and making sure that you've got a physician and all the medical personnel, everyone is on the same page, and really knows the plan, knows the guidelines for that area. So if you're bringing in medical from outside, that they're really clear on what the requirements are in this location. Where can you get testing? Is, in some places they won't test you unless you have symptoms. That doesn't necessarily work if you're using that for a pre-event requirement to have somebody have a test. So looking at what are your other options and making sure that your medical team is really up to speed and really kind of in line with each other. And then having a real clear line of authority and line of communication. So whoever is that lead is the spokesperson on behalf of that medical team or the organization, that there's not a lot of voices, because it can be very confusing, because it's very confusing because every day something changes. And so you need that one point of contact to help keep all of the communication kind of straight and going to the right direction. I added a link in here to the World Health Organization's mass gathering risk assessment tool, which if you haven't seen, is really helpful and just gives you a lot of the information I'm going on over today, but just a little bit more details of kind of checklist to make sure, especially if you've got spectators and other groups that aren't, beyond the athletes and kind of frontline individuals, how to make sure you've got all those pieces in step. And the CDC also has some really great resources. So like I already mentioned, connecting with your public health, making sure that they know that you've got an event going on. And so that they're, aware that this is what sport, these are kind of our threshold for sending somebody if they're sick. So that you already know if you're sending someone to the hospital, here's what you're going to need. They're going to ask you, you're going to need to have, and that can a family member go with you? What does that all look like? So making sure not only with the public health, but also, the hospitals and clinics nearby, what their policies are. Next slide. And then, thinking through who's going to be at the event. Are you going to limit it really only to the essentials of the athletes, coaches, kind of the bare bones, or do you extend that to media and volunteers? Other, massage therapists, we have ended all our contracts with massage therapists because it's partly because our massage therapists are out working in the community. And so mixing individuals who work with community members is a higher risk. And also they have a long sustained treatment. If they're doing, 2-minute flushes, that's different than a 60-minute or 30-minute recovery treatment. And so they just tend to be higher risk because of those reasons. And so, keeping that in mind, something that maybe you've always had in an event, in this instance, may be something that it's not going to be possible. And then obviously spectators and vendors, and every layer of those adds more risk. It's possible to have all those pieces. Obviously, we've seen events go on with people in the stands. It just becomes a lot harder, and you're going to need a lot more people to help with those mitigation and making sure that that is well communicated and signage and all of that. And then your check-in point of what are you, are you doing temperature checks? Are you making sure everyone wears masks? What are all those steps, and that's clearly communicated before people show up at the door. And then event participation screening, what does that look like both domestically and internationally? And this is where it becomes a bit more challenging again. If they're coming not only from states that may be higher risk, but internationally, now they've sat on a plane from Europe for 12 hours. All of these kind of things. Are you going to require that they have a quarantine or a test or 2 tests? We test on day 4 and 5, where you have the highest viral load. And so we do those tests. Doing tests on day 1 doesn't really give you much information unless you've, got symptoms typically. But day 4 and 5 and doing a 2-day test is typically better, so that you have less risk of missing it. But obviously that's a little bit harder. It's expensive. Most hospitals don't allow you to have a two tests, and insurance will usually only cover 1 test. So being creative with that, or having somebody get a test prior to arrival and, prior to departure and on arrival, things like that. So thinking through some of those, but it becomes a little bit more challenging. And again, I kind of point you back, if you can have good relationships with your medical facilities, they may be able to help you with those guidelines. And then obviously this population, the parapopulation, almost all of your athletes are going to be at high risk for a variety of reasons. And so, that is really key. And I think why we're, just even more cautious around our Paralympic population and making sure that we've got an even bigger kind of bubble and caution, tape around them, just because, if they do get impacted by COVID, it could be very, very bad. And so just being a lot more careful and making sure that, those things are clear. Another thing that, and I think I mentioned a little bit later, is having a contract, because a lot of athletes, they're so excited to compete, they don't want to share that, I've really got a sniffly nose, or now I can't taste, or something, I'm just going to keep it to myself. That is really dangerous in this scenario and situation. So making sure that it's a safe environment, that they feel like they can share that information, and whether that's a symptom tracking, we do kind of a symptom tracking 3 times a day. The athletes get it, and they have to enter their symptoms and take their own temperatures. And that just helps us. We've been able to pick up on people very early with little things, and find out, is this something we need to be worried about or not? And so having some information like that is really critical. Next slide. Making sure that you have enough PPE and equipment. So, the full shields, masks, covers, gloves, shoe covers, all of that for coming in contact with those who may have an infection. And thinking about all of these people that come in contact with, individuals, including transportation is another one that I think is on there. If you're transporting an athlete to the hospital or between their hotel and not, all of these different scenarios are places where either that individual who's driving and is typically out in the community could be a risk to your athletes, or vice versa. And also making sure, all of the equipment, the cars are cleaned in between use, and all of these kind of next steps, your buses, all of those type of things. So thinking through that. And then, the location of your medical clinic within the facility, having isolation rooms, so that if you do have someone that has symptoms, you can isolate them from the rest of the group until you determine, are they symptomatic that you want to send them to a facility or not? Do you send them by ambulance? What does that, access routes look like? And making sure your security is well aware of that, so we don't have, possible positives walking around the venue trying to find the ambulance, or different things like that. You have very clear, here's where I put them. It's right near the door where the ambulance goes. So thinking about that. And then, like I said, the cleaning protocol, making sure everyone's staying distanced, with your check-ins or things like that. We're using thermal cameras, asking the signs and symptom questions, all of those kind of things help to reduce the risk. Somebody could always, get through, but it's kind of what you can do to the best of your ability, and hope that everyone is kind of on board and being honest with that as they go in. Next slide, please. So obviously, like I mentioned, making sure education, both to the athletes, the teams, and those, family members, spectators who are coming in. What is the process? What does that look like? What are we expecting of you? Here's what it's going to be. It's going to look and feel very different than a previous, pre-COVID event. It's going to take longer to get through your event because we're, having to do additional testing, or making sure all these other pieces are in place, the screenings, all of those. Trying to keep that social and physical distancing, separating between venues, the cohorts, like I mentioned, having lots and lots of hand sanitizer and tissues and garbage cans and all of that stuff, where you can't, you almost have to trip over it because it's just all right there. Just to make sure, not allowing water fountains or places where, we could have super germ fests, making sure people bring their own water bottles, and just thinking through some of those things that just, kind of maybe fall off the radar. But those areas where there's a lot of touches and surface areas, making sure that we clean that really well. And I think that's a really key piece with our para population, just because a lot of times, they've got their wheelchairs, or, they're touching the walls and different things like that to get around, and they're just at more risk for that. So making sure we emphasize, don't touch your face, don't, all of these things, especially if they're in their wheelies, and then, are touching their face, which we try to educate anyway, but now is really not a time to do that. Making sure everything is clean, having really good cleaning staff, who are all, again, wearing their PPE. Having people bring their own food instead of having cafeteria type or delivery, or, places where there's a lot of interaction with food, having things pre-wrapped or packaged so that there's less contact and it's kind of more consistent. And as I mentioned, the athlete agreement. Next slide, please. So if there is an infection suspected, then, here's kind of just some steps. So if it's at the entrance, you don't let them in. If it's outside of that venue, then you're going through kind of the things we talked about, looking at the signs and symptoms, getting them assessed, and then getting them out of the venue, and then making sure everything is very much cleaned afterwards. Next slide. And as has been mentioned, making sure the communication is really clear. There's so many moving parts anyway in an event, and then you add in the complexities that I've mentioned, and a lot of different people that may have a different role, and it's really critical. But if any one piece of that, if this table isn't cleaned between people, that could be your weak link that causes an issue. So really having real consistent and probably even practicing that before an event and talking through scenarios, just like you would for an emergency, but now adding in the infectious disease piece. Next slide. And that is that. And I was asked to just kind of touch on where we are with Tokyo. And as of now, Tokyo is on, and we have gotten a lot of information from Tokyo in the last few weeks. And we'll be getting a lot more around December time. So they're planning and moving ahead. Obviously, the challenge is going to be getting athletes qualified to go to the games because a lot of events are canceling around the world. But we're planning and we're moving ahead. We are ordering our supplies and starting to pack those up. We've got our staffing. So we're just working on that. Tokyo is going to have a very good mitigation plan, and we will have a great plan on top of that to kind of be double safe. So as of right now, everything's moving ahead, and we hope that will continue to be the case. So I hope the same with your events, that all will go well. And I think we have question and answer at the end, so I'll be happy